Well, COVID's not the only challenge to our healthcare system. We've seen a huge number of RSV cases. Flu season off to an early, aggressive start. Of course, we've been calling this the Tripledemic, and now it's starting to take a toll on frontline healthcare workers and, of course, the patients who need their care. WBZ Chief Investigator Cheryl Fiandaca spoke with a nurse at Brigham Women's Hospital about what she says is the only thing that'll help.
Hire more nurses and hire more nurses.
It's no secret hospitals have been experiencing staffing shortages. Since the pandemic, nurses have been leaving the profession.
It's providing challenges to provide care safely and effectively on a daily basis to our patients.
And with the rising cases of flu, RSV, and COVID, nurses are also getting sick.
We've seen more nurses actually that get COVID and the flu over the past month or so than we've seen in a long while.
The I-Team reached out to Mass General Brigham. A spokesperson told us the hospital has hired over 550 nurses and 260 traveling nurses. But they admit an uptick in patients due to these viruses and staff illnesses have created a challenge, saying we remain focused on supporting our staff and providing high-quality care to all our patients amid capacity constraints and growing numbers of patients in need of care.
Last week, at one point, there was over 60 boarders waiting for beds. So they were waiting in the emergency rooms. And sometimes that's a hallway. That's not even a room. And it's certainly not a great environment to be cared for or to take care of people.
Mass General Brigham says long waits in the emergency department is a nationwide issue, partly because patients are sicker and need longer stays, all of which makes the nurses shortage more difficult for everyone.
But what's happening is we can't open every single bed because we don't have enough nurses to take care of a person in every single bed. So that needs to be resolved.
Cheryl Fiandaca, WBZ News.